Hi everyone, it's Christina Monaco, the owner of Bespoke Aesthetics here in beautiful West Palm Beach, Florida. So what we're going to be doing today is giving my lovely patient here a amazing non-invasive lift and tightening of her lower face and neck. So it's a great treatment to again get rid of tech neck, which are those horizontal necklines. It's going to help improve the crepiness on the skin, so it's going to improve the texture, and most importantly, it's going to non-invasively lift and tighten her lower face and her neck. One is with Sculptra, which is a injectable that creates and stimulates your own natural collagen. And why this is important is because we are going to be treating her lower face as well as her neck. And what we're going to also be doing is a treatment with a device called Softwave. And Softwave is probably the latest in technology when it comes to lifting and tightening, but with no downtime. So what we're going to do with the Sculptra is a couple of things. We can see that, like I said earlier, she's in her mid-40s, and we do have, you can see here, a lot of skin laxity. What we have to realize with skin laxity is that it doesn't just form where we see it, okay? If you looked at the patient straight on, you're going to notice that yes, she has skin laxity here, but it didn't start here. It actually started here, here, and here. And what we also want to understand is that the aging process, because of that skin laxity that we noticed here, is not just affecting the skin, it's affecting the bone, right? So like the foundation of the skull and the skin, and it's then affecting the muscle, and then it's affecting the fat. And so what we need to realize is if we want to give patients some sort of a lift to give them a maximum effect without having to put hyaluronic acid injectables in the front of their face, right? Not injecting here, not injecting here. The way that we can do this, and this is what I like to call is like this ponytail or this lift, where patients do not realize that they're having it done, and other people that look at them realize they haven't had treatment done, is here. Now, we start with 1 vial of Sculptra, but that doesn't mean that the treatment stops there. We start with 1 vial, I'll take a step back and I'll look. In this case, we're gonna use 1 vial today. Some patients may need a second vial a month or 2 months afterward if they have a lot of volume loss. Again, if you're somebody that has lost a lot of weight recently, if you are somebody who is just starting your aesthetic journey and maybe you haven't done any treatment and now you're in your 50s, 60s, we have to realize that we can't just use 1 vial or 1 syringe of anything to get the desired outcome. She still is going to need some work here at some point, and that this is also why we're doing the Softwave. You can see how much skin laxity and how much turgor she has, right? When I pull this back, this snap test, you can see that she has a lot of skin laxity, even here. So what we're going to do is, yes, she's going to get a great lift from this, and we are going to have treatment with the Softwave here, and this is going to tighten all of this, it's going to tighten all of this, it's going to help these lines, and she's gonna walk out of here with a little lift here and slightly tighter neck and lower face that will get better over time. So we are getting ready to start our Sculptra and Sofwave treatment. First thing that I have to do is I have to mix the Sculptra. The Sculptra comes in a powdered form, if you can see, and it is diluted with sodium chloride. We add a little bit of lidocaine, and we get it down to a dilution that is great, particularly where I'm doing the treatment for collagen stimulation and giving the patient that look as if she has had a lateral or a ponytail lift or a lift in the lateral part of her cheek here. Now, if I were doing this like on her neck, or if I was doing this anywhere on the body, I would dilute it even more. And so it would have a thinner consistency. And the reason for that is so that we don't develop in thinner skinned areas more, or the possibility, for nodules, or little tiny nodules. So I'm gonna start mixing. Sculptra is used to stimulate your own body's natural collagen. And the reason that we like to use bioregenerative treatments, especially, today in this, in 2025, is because we like the idea of our body creating or having the ability to create its own collagen. Very great for patients who have had weight loss. Maybe somebody has had, has been on GLP medications and they've noticed a significant amount of weight loss. This is perfect for them. It doesn't show up automatically. What I mean by that is you will see a result, but after the treatment. But really what happens is the beauty when you inject this on the face, the neck, or in the body is that it's going to take about a full 3 months for you to notice the full effect. And the reason why we're doing this treatment today again is to give her some collagen, lifting and tightening the lower face, the jawline, and her neck. This is the device right here. This is Softwave. And this device is ultrasound induced, meaning that it uses ultrasound waves to lift and tighten and build collagen. This is the handpiece. It's really simple. When I touch it, it feels like nothing right now, but as the machine warms up, this is a cooling tip and it will start to get cool. So it does not burn the skin. And we know that the depth of the ultrasound waves, the ultrasound energy gets down to 1.5 millimeters. We know that that's a safe space so that we are getting down to the muscle for that lifting, for that tightening, to build collagen, but it's also safe to make sure that we're not creating any fat loss. We know that if we heat that tissue too high, or if we're too aggressive with certain tightening treatments, we can burn fat and therefore cause more laxity. I was very particular when, and I still am, when choosing devices to use on my patients. Not everyone's a candidate for every device. And not only that, but not every device is a candidate for me to have in the office because I want my patients to see results and not have fat loss. It also is dependent on the provider doing the treatment for that fat loss, but we know that with Softwave, we're in a safe space and patients absolutely love it. So you can see that we have ultrasound gel, and we need that ultrasound gel to act as a conductor. I'm gonna start. So you're gonna feel 4 seconds of nothing and then 2 seconds of heat. How was that? Okay. So we keep moving down, and certain areas may be more warm than others or more of a sensation than others. Who do I like to do Softwave on? For me, everything is really patient specific. I have done this device on patients, men and women, who are in their 60s, mid 60s, late 60s, and I've done it in patients who are in their 30s. It depends on the area. We all, a lot of times, will say that we don't like, for instance, our forehead or our, the eyelids. We feel like we have crepey eyelids, or that we feel like they're drooping. And, for somebody who's in their 30s, that may just be genetic and hereditary, and maybe down the line they'd be a good upper or lower eyelid candidate for surgery, but they clearly aren't ready for it. Same thing with patients in their 40s. You know, the aging process, we know it starts in our mid 20s, and by the time we get to early 40s, mid 40s, there are patients that are contemplating whether or not surgery is an option for them. Again, I'm not a surgeon, but I know that we can definitely do non-surgical treatments until the patient is ready for surgery, and Softwave is definitely one of them. When it comes to age for the patient, I feel like I really like this treatment for somebody 30s to mid to late 50s. There's no age though that says that patients that are older can't do Softwave. Like I said, I have had patients that are in their 60s and 70s that I've done this on, but it really depends on like their skin, the quality of their skin, how much laxity do they have, you know? That is what I'm thinking about while I'm doing a consultation when patients come in and they're saying to me, you know, I hate the sagging skin on my neck or around my eyes, or, you know, the crepiness of my arms. And sometimes, you know, I have to say to them, these treatments are going to be great for you, or, you know what, you really are a surgical candidate. And, you know, I think that, you know, if you're open to plastic surgery, you're going to get the best result. Again, it's all about giving the patient the correct expectations, but also giving them the best outcome. And for me, I would rather, of course, always be transparent and honest. All right, so we just finished her Softwave treatment. How was it?
Not bad at all, actually, really good.
And you can see I'm taking the gel off. It wasn't bad. So after the treatment, you just want to make sure that you're still using all of your medical grade skincare products. As you know, I'll have you sit up, but there's no swelling, there's no bruising, there's nothing. It looks like you did when you walked in here in terms of the way the skin looks. So you could go about your day, you could go to dinner or wherever you need to go, errands, all of those things, which is a great thing about Softwave. We just say, you know, no strenuous activity, no excessive heat, like at a sauna or steam room or gym for 24 hours. We just don't want there to be anything that can mess up the inflammatory cycle. I would say try to avoid Motrin or Tylenol. What happens is this sets off an inflammatory cascade to tighten and lift. So in the first 24 hours, try not to have any Motrin or Tylenol if you can. But other than that, that's it. Now, everyone wants to know, do I have to do another treatment? So I just said, you're gonna come back and see me in 6 weeks. We're gonna take 6 weeks photos. We're gonna see the best results by 12 weeks. That doesn't mean that you're not gonna start to see results now, that you're not gonna see results next week. It's going to get cumulatively better, but by 3 months is when we expect to see those results. And then patients wanna know, when do I have to do another treatment? No sooner than 8 to 10 months, and that really is specific on the patient. Obviously more laxity and, you know, stubborn areas that need treatment, maybe closer to that 8-month mark, but we'll see, and we'll see how it goes. And that's really it. So I thank you for watching. If you have any aesthetic questions, please feel free to leave a comment in the comment section. If you are looking to schedule an appointment with me, feel free to call 561-337-3375, or you can click the link down below. Thank you.